Now that our patient has checked in, we're going to take this opportunity to update some of our meaningful use requirements in the patient's demographics. I have two ways that I can accomplish this. I can either come up to the patient's demographics button and drop down into their ethnicity, and as you can see, it's not recorded yet. I can change this at that time to my non-Hispanic, which was on their intake paperwork, and update their language to English and do an alpha search. And I can update their race as well. And click Save. And now you've seen that information has now updated on the intake dashboard that I have set for that patient. I still have some empty areas that I can update as well. Maybe we didn't record that the patient was married or their PCP at that time, or maybe I wanted to add some information as to how they were referred to our office. By clicking on my link, I can update his marital status as well. Now that my patient has checked in at my front desk and I have updated his basic demographic information, my medical assistant is now going to take this patient back to the treatment room, and we're going to change our view to our medical assistant's dashboard. And as you can see, we haven't recorded any of their medical history or any surgical history or any allergies or medications just yet with this patient. So the medical assistant is going to get this information from the patient. And we're going to start with their vitals. As you can see, I have a link for it on my dashboard, as well as a link over on the right-hand side of my screen in my patient chart. I could record them either place just by clicking in either location. They bring up the same window. I'm going to add them from the side so you can see how it shows up on my dashboard. My patient is going to be, we'll make him about 5'8" and 165 pounds with a normal temperature and a normal blood pressure. I've now recorded my structured vital data, and as you can see, it's now populated to my dashboard. I've asked my patient if he's taking any medications, and he tells me he's taking ibuprofen or Motrin. So we will add his medications, and I can search Lexicomp for ibuprofen. And there's my list of commonly known names for ibuprofen, and add that to his medication history. I could also at this time add his allergies, which he's telling us he's allergic to ampicillin. And again, I'm going to move over to Lexicomp because I want to include my drug interactions. And add that, and close. I've now added his medications and his allergies, and I've done that from his dashboard, or I could also add that from his medication and allergies tab at the top of his chart. I'm choosing to do it here so that I don't miss any of the questions that we're asking our patient before the doctor's ready to see him. We're also going to ask his past medical history, and as you can see, I have a past medical history right here, and it's right now set to no significance, so we're going to get rid of that because he tells us that he does have high cholesterol, and I don't have that on my drop down, so I can add that just by clicking my Update My List add a new row, high cholesterol. And update. And I want to update my list. So now I have high cholesterol as an option. So now we have a past medical history, including high cholesterol. He has a past surgical history of carpal tunnel. And again, I don't have that. Oh, I do have that on my list already. I can just click and add that. And now I have his past surgical history of carpal tunnel. At that time, if I wanted to add his email information or emergency contact, I could do those as well. So I've now taken my patient's medications, allergies, past medical history, past surgical history, and I'm going to check their social history. And again, I have the option of checking here or here. Same with the medication and surgical. I can do from here as well. So I'm going to click on his social history, select it from my right-hand side. We already know that he was married, so we're going to update that. He's employed. We've asked on our review, does our patient drink? He may have a drink a day. And has he done it long? Well, maybe for the last year or so. We're going to record his smoking status in a structured environment. By clicking on our smoking status, it's going to bring up our options for our smoker. Has he a current everyday smoker, someday smoker, former, never smoked, current smoking not known, doesn't know if he's ever smoked, heavy tobacco user, light tobacco user. Our patient has never smoked, good for him. And we're going to add that to his social history and save. So now we've updated his social history. We've updated his past medical history, allergies, medications. Our questions have gone through all of his information here. The doctors also wanted us to do a review of systems for this patient before they're ready to see him. And everything with our patient is within normal limits, which is what our WNL stands for. If I needed to change anything, going through our questions and review of systems with our patient, I would just need to click on that within normal limits, and I could add from my list, or I could text anything in there that I needed. But our patient is all normal, so we're going to leave everything within normal limits, and save and close. And his review of systems is done. That will be complete when the doctor starts his encounter. We took our patient's insurance information when he called in for his appointment, but if we had not, we could have updated it from our schedule, or I'm going to flip over to my billing dashboard, and as you can see, we had taken his insurance information and put in his policy number and group number. If he came in and had a secondary at that time and provided it, then I could add it here as well, just by adding the additional information by selecting my insurance at that time. Same way if I needed to add it, because we hadn't had it when we created the appointment. Very easy to navigate. All of my insurance information that's already in my system is available just by searching with an alpha search by name, or if I need it by the payer ID. So those links are on my dashboard for billing, or if I needed to, I could come to my billing tab and add insurance there as well and designate that as a secondary. All of the information for this patient is obtainable from either my intake paperwork dashboard, my medical assistant going through and asking their questions from their list, and now my physician is ready to see that patient, and they now know what their allergies are, what medications there are, what their past surgical history is, and they're ready to see this patient. At that point, we're going to have this turned over to the doctor to start the encounter for this patient.